Good morning. I'm Miranda. I'm going to be your nurse today. Can you tell me your name and date of birth? All right. Thank you, Mr. Smith. Are you allergic to anything? No? Okay. All right. It looks like the provider has ordered what we call an NG tube or a nasogastric tube. Have you had one of those before? Yeah, so it's just a kind of flexible tube that goes down your nose into your belly, and it's going to allow us to give you some medications and some feedings. We'll give you some food through it too. Okay. A couple of questions. First, I have some students here with me today. Do you care if they come in and I kind of walk them through this procedure? Perfect. Thank you. Have you ever had surgery on your nose? No surgeries. Have you ever broke your nose? No? Okay. Let me just take a look if you don't care at your nose. So looks like his nasal septum is midline. When I look in his nares, I don't see anything protruding, no polyps or masses or anything. Okay. I'm going to occlude one of your nares and have you to breathe in and out. Good. Okay, the other one. Okay, so it sounds like he can breathe in and out of both of those nares. I'm going to go ahead and look in the back of your mouth. I got a tongue blade. I'm just going to check your gag reflex. Okay, sorry about that. I'm just making sure that he has a gag reflex so that I know if that tube does get coiled up as I'm placing it in the back of his throat, that he is going to gag and it's not going to choke him. Yeah. Okay. All right. So, do you take any anticoagulants? You don't. Okay. So that's a blood thinner. No blood thinners? Okay. So if he would take an anticoagulant or an antiplatelet, we would just need to be extra cautious because that would increase his risk for bleeding as we kind of put that tube down. Okay. So just something we'd be aware of. All right, mister, I'm going to sit you up a little bit. And I'm going to get all my stuff ready. Does that sound good? Okay. So take a look at my supplies here. I washed my hands and I put on my gloves. I'm going to set those to the side. I do have some tape. I'm going to go ahead and just, this is paper tape because it is going onto the patient's skin. So I'm just going to grab a couple of pieces and I'm going to tear those off. One of my longer pieces I'm going to split. And so I'm going to have like one larger part and two splits. And I'll show you what we're going to do with that shortly. And then I'm just going to have a smaller piece, and this is going to get wrapped around my tube when I measure. I do have a skin protective wipe that I'm going to put on the patient's nose before I put that tape on his skin. I do have some lube because I am going to need to lubricate the end of our tube before we insert it into his nose. I got just a chuck, so a drape. I'm going to stick this down, and that'll keep any secretions off of you. I do have this irrigation tray with a piston syringe. So just a syringe that I can actually push and pull. I do have a cup with a straw, and I can put like water in here. And if the patient is having trouble with the tube advancing, I can have them to take sips of water. And then I have my tube. So I'm going to go ahead and open it. And when I pull it out, you can see it's in a separate little package. I'm going to put that to the side because that is actually where I'm going to put my lube in order to lubricate about 4 inches of the tip of this tube. Okay. So when you look at the tube, we have this end and we have an end that looks like this. This blue thing is a vent. So you would never want to put your syringe or medicines or feedings through the blue part, right? This part here is where our syringe is going to go, that big center. So for now, I'm just going to do what we call clamp that off, okay? And I need to measure this tube in order to see how much needs to be inserted into the patient, okay? So I'm going to go ahead and I'm going to put my loop down. So like I said, I'm going to put it on my little thing here. And next, I'm going to go ahead and I'm going to measure this. Okay, so when I'm measuring, what I'm going to do is I'm going to grab the end of my tube and I'm going to place it on the bridge of my patient's nose. Okay, and then I'm going to hold it and I'm going to go to the earlobe and I'm going to hold it and I'm going to go down to their xiphoid process. And then that tells me how far it needs inserted. Okay, so again, move this out of the way for a second. So the tip to the nose, to the earlobe, and then to the xiphoid process. So I'm going to put my smaller piece of tape right here, and that'll tell me when I should be in the stomach. That's just to flag me to stop. Okay. All right, now I can go ahead and lubricate the 4 inches of this tube. When you guys are practicing in lab, you need to lubricate with the approved lubrication or they're not going to advance. Now, my cup is, I'm going to give this to Mr. Smith, and if he needs this when I tell him to swallow, then he can use that. Okay, so I'm going to start by just kind of placing my hand behind his head, and I have my tube here, have the lubricated portion out. I'm going to use this nair, and I am just going to kind of take it, and it's going to curve down. And whenever I get to the nasopharynx, I'm going to feel a little pressure. And at that point, I'm going to push, and I'm going to have him lean his head, so chin to chest, and I'm going to have him swallow. And at this point, he can take sips if needed. And he's going to swallow, and I'm going to push. Right? Swallow, swallow, swallow. Okay? And then once it's to my tape, I'm going to go ahead and do my skin protectant here on his nose. Okay? All right. And then I'm going to take my tape. The big part that I didn't split goes on the top of the nose. And then the 2 part that split apart is going to wrap around the tube. Okay? All right. Now, in the hospital, there are specialized tube holders that are considered commercial tube holders for the NG tube. All right. All right. Once I have got it inserted, I need to verify placement. And there are a few ways that I can do that. I can have the patient to talk. If they can talk well and it's not kind of garbled their voice, then it should be correctly placed, meaning that it's not in the back of their throat. I'm going to visualize and look in the back of their mouth to make sure the tube isn't coiled up. The other thing I'm going to do is I am going to grab my stethoscope and I'm going to grab my piston syringe and I'm going to inject about 20 mLs of air. So just depending on your facility policy, you can do saline, air. I like to do air just so that way if it's not in the correct place, I'm not putting any kind of saline or liquid into their lungs. So I'm going to go ahead and stick my stethoscope on. I'm going to place the diaphragm right over their stomach. My piston syringe is going to go in the large part here. So I've already drawn up the air, so 20 mLs. And then my stethoscope, and then I'm going to inject the air, and you should hear kind of like a gurgling sound, which I heard. That gurgling sound indicates that we're pushing air into the stomach. Then it has to be verified by x-ray placement, okay? So we need to get an x-ray. The other thing that we can do is we can draw up a little bit of gastric contents, so 10, 15 mLs. We can put that on pH paper, and we can test the pH. The pH of the stomach should be less than 5.5. And so, again, you're good to proceed on with the x-ray if your pH is less than 5.5. Okay? All right, Mr. Smith, they're going to come and do a chest x-ray so we can see if that tube's in the correct place, and then we can start using it, whether we're going to use it for feeding, whether we're going to use it for meds, or if it's going to need to suction. Keep in mind that when we talked about giving the patient something to drink, that if your patient is NPO, if they have strict NPO, if they have any kind of dysphagia or difficulty swallowing, you would not want to give them liquids during this procedure. You can still give them the cup and the straw empty, and when you need them to swallow and put their head down, you can instruct them to do that, okay? If your patient is confused and they're unable to follow commands, you can have a friend to help you kind of slightly push their head and their chin down, okay? All right, now we're just going to get Mr. Smith all cleaned up and get him his bed load down and get all his stuff back where he needs it. All right. Hello, I'm Miranda. I'm going to be taking that NG tube out today. Yeah? Can you tell me your name and date of birth? Okay. No allergies? All right. So it looks like that we can get that NG tube out today, that tube in your nose. I'm going to get you kind of sitting up a little bit. Get some hand sanitizer and some gloves on. Mr. Smith, I have those students with me again today. Do you care if they watch and I kind of walk them through removing that? Yes? Perfect. Okay. All right. So the first thing we're going to do is ensure that we have an order to remove the tube. We also need to check to see if the patient is getting tube feedings or medications that we waited at least 30 minutes after the completion of that. We are going to need our piston syringe. We're going to need some skin adhesive remover, and we're going to need just a chuck. So we're going to place the chuck over the patient, and I'm going to put it up a little higher this time so that when the tube comes out, I don't get anything on him. So wherever the tube's connected at, on whether it's adhered to the patient's gown, safety pin, taped, take that loose first, okay? And then we want to go ahead and we want to push 15 mLs of either saline, air, in through the tube to clear it, right? So again, through that larger hole, and I've got 15 mLs of air, and I'm just going to push that in, and that's clearing out that tube, so that as I'm pulling that out, nothing gets left behind and causes an aspiration. Okay, I'm going to go ahead now, and I'm going to take the skin adhesive remover, and I'm going to put that on the patient's nose. And this is just going to help to ensure that I'm not pulling skin off, right? Okay, Mr. Smith, are you ready? All right, so I'm going to peel the tape off, and then ready, 1, 2, 3. And I'm going to pull that tube out. Tube looks good. All right, and then I can get him cleaned up if he's got anything on his face. And I'm just going to have him to cough and kind of clear anything that got left behind. Great. All right. Okay, now we're going to just get him back to a comfortable position. Is there anything we can do for you?